Hello everyone, I am Mariah Angela F. Pineda, student nurse from BS Nursing 2 here in College of Our Lady of Mount Carmel. So the procedure that I am going to do today is immediate newborn care, and the purpose of this procedure is for assessment of the newborn, and it includes immediate and thorough drying, early skin-to-skin contact, properly timed cord clamping, and non-separation of the newborn from the mother for early breastfeeding. So first, for the assessment, we have to make sure that the room temperature is from 25 to 28 degrees Celsius. And then we have to prepare for the materials needed. So in the linear sequence, we would have gloves, 2 dry linen, bonnet, oxytocin injection, plastic clamp, Kelly forceps, Mayo scissors, and 2 kidney basin. Then in a separate linear sequence, we would have vitamin K, stethoscope, hepatitis B vaccine and BCG vaccine, and micropore tape if needed, and also cotton balls. Then next is we have to check for the resuscitation area for cleanliness and functionality of the materials. Then for nursing diagnosis, it would be risk of body temperature alteration related to inability to shiver, change in environment from intrauterine to extrauterine, and limited amount of insulation. For expected outcome, the newborn will be free of infection and complication that precipitate hypothermia and cold throughout the stay here in the hospital. Then for interventions, first we have to wear our mask and bonnet properly. Then we have to wash our hands and observe infection prevention control and wear our gloves. Now, for 30 seconds, we have to immediately and thoroughly dry the baby. Now, assuming that the baby is placed on the mother, so first we would dry the baby for 30 seconds with a dry blanket, starting from the head, on the face, eyes, nose, front, then back, then the extremities of the baby, arms, then legs, then while we are drying, we would observe for breathing, and do not suction unless the mouth and the nose of the baby is blocked with secretions or other materials. So when the baby is breathing and crying, we would position it in a prone position on the mother's abdomen or breast. Then, we have to cover the back of the baby with a dry blanket and cover the head of the baby with a bonnet. Then, for 1 to 3 minutes, we would observe for the pulsations of the cord. So, we have to palpate the cord. Then, once the pulsations has already stopped, we would clamp the cord with a plastic clamp 2 centimeters from the base. And do not milk the cord towards the baby. Then, clamp the cord with a Kelly forceps, assuming that this is a Kelly forceps, 5 centimeters from the base. Then, we would cut the cord with the Mayo scissors closest to the plastic clamp. After that, put the identification name of the baby on the ankle and not on the arm with its corresponding gender. Then leave the baby in a skin-to-skin contact. And observe for feeding cues like licking, tonguing, or rooting. And then instruct the mother to observe and encourage for feeding cues so that the baby could breastfeed. So mother, when your baby is licking, tonguing, or rooting, we would encourage you to nudge so that the baby could breastfeed. Then after 90 minutes, we would transfer the baby from the mother to the working table. So again, assuming that we have transferred the baby to the working table, so first we have to weigh the baby. So the normal weight of the baby should be 2.5 to 3.5 kilograms. And we can determine that the baby is small for gestational age if it is less than 2.5, and the baby would be large for gestational age if it is more than 3.5 kilograms. And then proceed with assessing the baby physically. So first is for general appearance. We would have to assess for physical activity and the muscle tone, as well as the posture and level of consciousness of the baby. And then next is we have to observe for the skin. So included are the color and texture of the baby. Then next is the head and neck for shape and size of the head. Then next is the face. We have to assess for the eyes, ears, nose, and then also the cheeks. Then moving on, we would have to assess for the mouth. So the roof of the mouth, or what we call palate, and also check for the throat. And then next is we would have to assess for the lungs of the baby. We have to check for breathing pattern and also the breath sounds. Then next we have to also assess for the abdomen of the baby. So for abdomen, you would assess for the presence of masses. Then next is the genitals and anus. We would have to check for the passage of urine, as well as if there is an imperforated anus. Then lastly, we would check for neurologic for tone and reflexes. Then moving on, we would also assess and check for APGAR scoring. So APGAR is for appearance, pulsation, grimace, activity, and respiration. So for appearance, if the baby is blue, it would be 0 points. If the baby's body is pink and the extremities or arms and legs are blue, it would be 1 point. And it would be, if the baby's body is pink and overall, it would be 2 points. Now for pulsations, if there are no pulsations, it would be 0 point. If the baby's pulse is below 100 beats per minute, it would be 1 point. And if it is over 100 beats per minute, it would be 2 points. For grimace, if the baby is floppy, it would be 0 points. And if the baby has minimal reaction to stimulation, it would be 1 point. And if the baby has a good reaction or stimulation, it would be 2 points. Then for the activity, if the baby has no activity or has absent movement, it would be 0 points. If the baby is flexing his arms or legs, it would be 1 point. And if the baby has an active movement, it would be 2 points. And lastly, for respiration, if there are no respirations, it would be 0 points. If there are slow and irregular respiration, it would be 1 point. And if there is a proper respiration and the baby is crying actively, it would be 2 points. So 0 to 3 score, meaning that there is an improper or abnormal assessment. 4 to 6 would be there is a need for support. And so 7 to 10 meaning the baby has normal assessment. Then after APGAR scoring, we would proceed with the so first for the head, the normal should be 34 to 35 centimeters. For the chest, it should be 32 to 33 centimeters. Then for the abdomen, should be 29 to 33 centimeters. Then for the mid-arm, it should be 7.5 to 13 centimeters. And the length of the baby should be 46 to 50 centimeters. Then for the rectal temperature, it should be 36.1 to 37 degrees Celsius. And this is also to check if there is an imperforated anus. Then next is we would inject vitamin K to the baby. So vitamin K should be intramuscular and the left vastus lateralis of the baby. Since newborn lack vitamin K, we would provide vitamin K as it promotes clotting to blood so that we could prevent excessive bleeding. Then next is the hepatitis B vaccine. IM on the right vastus lateralis, 0.5 milligram. We would give hepatitis B vaccine to prevent liver disease that is caused by the hepatitis B virus. Then lastly is for the BCG vaccine, 0.05 ml on the deltoid region. And this is to prevent severe tuberculosis to newborn that can affect the lungs and brain of the baby. Then after injecting, we would proceed with eye prophylaxis. So, we would apply erythromycin from inner canthus to outer canthus on both eyes, inner canthus to outer canthus. And then apply the baby's clean clothes. Then cover the baby with a dry blanket. So, assuming that we have covered the baby with a dry blanket. Then, assess or obtain for the heart rate and respiratory rate of the baby. It should be 120 to 160 beats per minute. And for respiration, it should be 40 to 60 breaths per minute. And then lastly, we would show the baby to the mother. Then, for evaluation, we have to document for anthropometric measurement, Apgar scoring, medication given, and footprint. And that would be all for immediate newborn care.